Welcome everyone. Thank you for joining us today. I'm Teresa Marentat, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please be reminded that public health measures continue to be the most important protection to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water, or use an alcohol-based hand sanitizer. Use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when attending commercial establishments. For area businesses, visit our website to access our Safe Return to Business Toolkit. I will now report our current case counts. There are 104,772 confirmed cases of COVID-19 in Canada and 35,370 cases in Ontario. Chatham-Kent has 158 cases, and Sarnia-Lambton has reported 285 cases. Michigan now has 64,675 cases, with 11,638 cases being in Detroit. Today, we are reporting 1,621 cases of COVID-19 in our community, an increase of 7 cases from yesterday. 1 person works in the agri-farm sector, 2 are community cases, and 4 are still under investigation. 971 cases have now resolved. 544 people are currently self-isolating. 25% of our cases are between the ages of 20 and 29 years. 23% are between the ages of 30 and 39 years, and 17% are between the ages of 40 and 49 years. 62% are male and 37% are female, with 1% unknown at this time. Our community has lost a total of 68 people to COVID. 49 deaths occurred among residents in long-term care and retirement homes. There are 2 long-term care homes currently experiencing a COVID-19 outbreak, and 4 workplaces in the agriculture sector experiencing a COVID-19 outbreak. Symptoms of COVID-19 range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing or are struggling to breathe or speak, or are experiencing severe chest pain, or if you are feeling confused or losing consciousness. Please be reminded that Windsor-Essex has 2 COVID-19 assessment and testing centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olette Campus. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. Yesterday, we updated the homepage of our website. You will now find the numbers, COVID-19 quick links, and our live broadcast on the homepage, along with the community calendar and other relevant public health messaging and updates. All the COVID-19 information is still accessible on the COVID-19 homepage. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Ahmed, our Medical Officer of Health, for our weekly Epi Summary.
Good morning, everyone, and thank you for joining us again. Today is exactly 1 week since I issued the Section 22 order to wear face masks, face covering in commercial establishments where physical distancing may not be possible. Just like many of the proactive measures that the Windsor-Essex County Health Unit took to protect and promote the health and well-being of our residents, Windsor-Essex became the 2nd region in the province after Wellington-Dufferin Guelph Health Unit to implement a face covering order. Since our order, many other regions followed suit. For example, Kingston, Toronto, Peel, Ottawa, and others are already moving in the direction to enforce face covering in commercial establishments. In Windsor and Essex, we can clearly see that almost everyone is wearing face covering in the commercial establishments. It is important for me to remind everyone that there are individuals who are exempted from wearing a face covering on the premises if the person is a child under the age of 2 years or a child under the age of 5 years, either chronologically or developmentally, and he or she refuses to wear a face covering and cannot be persuaded to do so by their caregivers. Wearing a face covering in individuals that would inhibit the person's ability to breathe in any way. For individuals who have, for any other medical reason, they cannot safely wear a face covering such as, but not limited to, respiratory disease, cognitive difficulties, or difficulties in hearing and or processing information. For any religious reasons, the persons cannot wear a face covering or cannot do a face covering in a manner that would properly control the source. Individuals are also not required to carry a proof of exemption to show why they're not wearing a face covering. Our community has done an amazing job in following public health guidance and supporting everyone in our region. I would once again remind that the commercial establishments to follow the order. I would request our community members to please use face coverings in commercial establishment as much as possible. Those who cannot wear face covering for any medical reason should not feel pressured to wear face covering, and we should all support each other in achieving our bigger objective to do our part in controlling the spread of COVID-19 in our region. I will now move on to the epidemiological summary for this week. So very quickly, this is what we will try and cover in our presentation. Since there's a lot to go over, I will highlight the key points in each of these slides. The EpiCurve help us assess the progression of the disease, whether in the community or in an outbreak situation. Please note that compared to previous EpiCurve that we have presented, this EpiCurve is created to show the reported date, just to give more clarity in terms of when these cases are reported. There are a number of individuals who are now presented as asymptomatic, and for some reason, for the same reason, we put it together an EpiCurve by reported date instead. So if you are following and comparing it with our previous EpiCurves, you may notice that difference. So this figure includes all cases in the community, including cases in the long-term care home, retirement home, and cases in the agricultural industry. We can clearly see that day-to-day variation has caused throughout the pandemic, but more recently in the last week, we have seen huge spikes in number of cases, more specifically those 2 days where the cases coming from agricultural farm industry. In order to capture that day-to-day variation, we use a 3-day moving average by reported date. This 3-day moving average help us capture some of these variation to present a much better picture of how things are moving in our community. We can see that roughly since 2nd and 3rd week of May, the number of cases was going down. In early weeks of May, we noticed a further decline, but now we are seeing influx of cases mostly tied to the agri-farm sector. Looking further, breaking down the cases by long-term care home, retirement home, and those who are working in the agri-farm sector. Excuse me. You can see a spike in the last 3rd week in the month of May among those working in the agri-farm industry. Please note that all these agri-farm cases in the green is more recent cases that we have started to see, including the 2 major spikes in the last week. Looking at the 7-day moving average, one of the common methods to look at how we are doing is we use that 7-day moving average. The blue line looks at all of our cases using a 7-day moving average, and we can see a spike earlier on in the May, but now the most of the spike that we're seeing is resulting in the agri-farm sector. The green line below looks at the 7-day moving average if we have to remove all the workers from the agri-farm sector, which shows a much more steady picture of what's happening in the community, and it's almost in line with what we are seeing everywhere else in the province of Ontario. So this slide captures the week-over-week varied incidence per 100,000 population from week 18, which is the April 27, to our current week, week 27. We saw a dramatic increase in cases in week 26, which are primarily attributed to the agri-farm sector. And please note that week 27 is still ongoing, but we've already seen the decline, and the initial spike that we saw was all related to the agri-farm industry, and more specifically with one farm in particular. Comparing our regional and provincial rates across the province, we have moved up a little bit to be at the 3rd highest provincial rate because due to our recent spike in agricultural farm sector. We have experienced significant number of cases in the long-term care home and retirement home, currently 19%, but at the peak it was 42%. But right now we're seeing an increase in the number of individuals in the agri-farm sector that constitutes 43% of our overall cases since the beginning of this pandemic. So this graph is basically telling us how quickly we are getting the results, positive results, whether we're in 1 day or 2 days of the test date. So far our test reporting timeline has improved significantly, and more cases, our results are coming back quickly for us. So this particular graph shows what's the percentage of new cases that started investigated within 24 and 48 hours of reported date. And we can see that more recently what we have seen is all these cases that are coming to us. There was investigation started in a timely manner within 24 to 48 hours of receiving the results of these individuals. Looking at the age and sex distribution, here we look at this is what it looks like in the past 2 weeks. Overall, no surprises there. Just like previously, we are seeing more cases in male compared to female, and more younger people contracting COVID-19 in the last 2 weeks compared to before. The case distribution by municipality right now from June 2nd to July 1st, which is the last 30 days, 62% of our cases were from Leamington and 26% were from Kingsville. Looking at the past 7 days, it also tells us a different story. 83% of our cases in the last 7 days came from Leamington, while as Kingsville constituted 8% of the cases, followed and Windsor 9% of the cases, while a majority of the area did not report any new cases in the region. In the last 7 days, 85% of all the cases are from agri-farm workers, and that constituted more than 84% of the cases in the entire region. This particular graph shows how our cases acquired COVID. We see that early on it was imported to Windsor-Essex via travel, and from then we saw these cases in the community spread, but predominantly spread through close contacts. Close contact spread includes outbreak in institutions like long-term care home, retirement home. Close contact also includes predominantly agri-farm cases too, which we are seeing more recently in all of these cases. So the graph in yellow or orange bar, it shows the community spread, and if the community spreads are keeping contained in our region, that's where most of the public health efforts are. In terms of the close contacts, the public health measures to support individuals to limit the number of contacts is very important, and we are experiencing it more and more with the agri-farm sector, where number of close contacts, people sharing congregate living, a much higher number, leading to a much bigger impact with the spread of COVID-19 in that particular group. The slides look at the exposure of agri-farm workers in the past 30 days. While the majority of cases primarily acquired through the illness through close contact, we are also seeing instances where it is also community acquired, or if we do not have any evidence of how this infection was acquired by that individual. This particular graph shows the cases of COVID-19 by healthcare worker status. Among all the healthcare worker that acquired COVID-19 in our region, 77% were locally acquired, while 23% of the cases worked in Michigan and were diagnosed here in Ontario. Another question that is frequently asked: if the cases had underlying chronic conditions. About 27% of cases had some medical condition where it was chronic, but whereas the majority of the individuals, more than 73%, do not report any chronic underlying condition. The most common symptoms continues to be cough and fever, and that number, as we are seeing some of the cases in asymptomatic individuals, so that's somehow reflected in the most common symptom presentation. but individuals can present with more than one symptom. That's why these numbers will not add up. Looking at the hospitalization and ICU data for COVID-19, cases in the ICU remain relatively low and have gone down to 0. The red line indicates the 7-day moving average in the ICU, showing a decreasing trend in the ICU. Hospitalization have fluctuated more so than ICU. We have seen a sharp decline in the number of inpatient hospitalization for COVID-19 in the past 30 days. This slide depicts the capacity of our healthcare system in Windsor-Essex. The orange line highlights the occupancy rate of our acute beds. The threshold is to have the occupancy rate to be below 85%, which we are currently meeting. This signals that we are currently able to meet the demands related to COVID-19 if it increases in our community. The green and dark blue lines are ICU capacity and ICU ventilator beds, respectively. For ICU capacity, we'll look at the overall ICU capacity and ICU ventilator beds. While there is no established criteria for overall for ICU beds and capacity, anything that's less than 50% for ICU beds are still an acceptable measure to look at. Higher than this may lead to stress to the healthcare system if COVID-19 increases within our Windsor-Essex. So where we are with all these cases, almost 56% of these cases are resolved, 37% are self-isolating, and unfortunately we lost 4% of our cases to COVID-19. We are seeing a minimal number of cases in the hospital and at ICU, and we are still investigating roughly a small portion of these cases, 2.4%, as our team is working through that information and finding more information on that. Looking at the age and sex breakdown of COVID-19 deaths in our community, overall more female died with COVID diagnosis compared to male. From an age distribution perspective, almost 70% of the deaths were in individuals who were 80 years and older. The youngest person who died in our region was a man in his 20s. Comparing our case fatality rate with the province, we can see clearly that our provincial overall case fatality rate is lower than the provincial average. Our case fatality rate is 4.2% compared to the provincial average of 7.6%. If we're just looking at the long-term care home and retirement home, our case fatality rate is even lower than, lower than the provincial average. Our rate it was 16.1%, whereas the provincial rate was 22.1%. Looking at the cumulative doubling time for cases, we are well past day 6, and we're seeing a significant flattening of the curve throughout the beginning of this pandemic, since the beginning of this pandemic. Looking at the doubling time with the day over day comparison, we have seen a huge decline in the last week, which was resulted from the 2 major increase in number of cases from one particular farm. But now we are heading back, and in fact we are above the provincial average, and having any number above the provincial average is a good indicator to show that means we are doing better than the provincial average and the Canadian average. The most recent estimated mean R0 is 1.17. When the R0 is greater than 1, each existing infection causes more than one new infection. Our R0 estimate has increased recently due to the cases in the agri-farm sector. When the R0 is less than 1, every infection causes less than one new infection, signaling a decrease in the virus in the community. So we are now coming closer to the mark of 1, and eventually we would like to go down to below 1 in the sector. So in summary, Windsor-Essex has seen a spike in cases in late June, and it's mostly attributed to agri-farm sector. The primary source of exposure continues to be the close contact with confirmed case, so that's why it is still important for all of us to ensure that our close contacts continues to have a lower number, following the provincial recommendation and the recommendation of the Chief Medical Officer of Health for the province of Ontario to keep your social circle to less than 10 people or even less. COVID-19 related hospitalization and ICU capacity have decreased dramatically in June. R0 effective value is 1.17, indicating that every case is leading to more than one new cases, but we have seen variation in the past month, and many of these case increase that we are seeing is still limited to the agri-farm sector. Overall, the community has done an excellent job in preventing and reducing the number of cases in the community, and we continue to see that trend as we are looking at the cases outside of the agri-farm industry. Thank you.
The conference is now unmuted.
We'll now take questions from the media. We'll start with CTV.
Good morning. Can you confirm that Emergency Management Ontario is in the region and is taking a leadership role to respond to the temporary foreign workers and the agri-food crisis?
So we have been in conversation with the Ministry of Health Emergency Operations Center regularly to help us with the accommodation piece. There are a number of partners involved in that conversation. I cannot say that if they are here or not, but obviously this conversation and partnership is ongoing, and to ensure that we have all these accommodations secured and keep this individual isolated from the rest of the population to prevent any risk of spread in the community.
What is your take on the migrant housing unit in Leamington? How effective do you think this method will be to containing that crisis over there?
Can you repeat your question again, please?
What is your take on the migrant housing development that is up and coming in Leamington? How effective do you think this method will be in containing the crisis in the agri-food sector?
So we've been identifying and been talking about these accommodations, which is clearly a very important need. And as we are trying to battle with COVID-19, the most significant factor that what we are recommending right from the beginning of this pandemic is to have less number of contacts, follow physical distancing, and the concerns with this population is their congregate settings. The accommodation is very conducive for a spread of the disease in this group. So anything that we are seeing right now is obviously focused on the impact of what is happening with one particular farm. But as we continue to investigate and continue to test all these other farms, we are finding most of these farms, or the smaller farms, do not have these cases. So some of them are negative completely. So this would be something as an ongoing discussion and a challenge to find accommodation for those who need it. But we want to make sure that we have the capacity in the system to isolate these individuals. And those capacities questions have been raised many times by public health. And now we are seeing some impact on some support from the community, locally, provincially. So we're all coming together and trying to work towards the same goal of keeping our community safe.
Thank you.
Any questions from CBC?
Yes, Ashley. Sorry, let me just pull up my questions over here. Yes, so to start off with, the organization, and sorry, this is in reference to the Essex County Farm, I believe it's Nature Fresh, that was under the new Section 22 order. So to begin with, the organization that represents greenhouses says it's looking for a replacement workforce made up of local workers. Is that allowed?
So under the Section 22 order that was issued to that one particular farm, the section order specifically was written to achieve two objectives. One was to protect the workers that are currently working, those who are positive. And then the second objective of that was to limit the spread of infection among the workers who are currently exposed and avoid any potential spread back to the community. So those were the two objectives. And those objectives were met when we are removing all these workers from that workforce. The rest of the discussion need to be taken in consideration and consultation with public health, and that conversation is ongoing.
So, but I mean, again, just I suppose just to narrow down the question. So, is this facility allowed to look for a replacement workforce of local workers?
So I'll answer this question by saying that under the order, the focus was to remove the worker that are currently working. So that objective is achieved, and rest of the conversation will be ongoing, and we'll figure out a best way to keep the workers safe and also keep the community safe.
Okay, fair enough. My second question is, how concerned is the health unit about so-called illegal workers, as they've been identified as a potential vector of infection among workers?
Again, some of these challenges were identified right from the beginning, and that's why it is a big issue in our region. We are seeing a documented workforce of more than 8,000 to 10,000, and again, nobody keeps a tally on how many illegal workers or undocumented workers are working in the community. But from an estimate, it can be close to 1,500 or 2,000 people who are working undocumented here. So we want to make sure that we are doing our part with working with the employers and also working with different levels of the government to focus on the goal of preventing and reducing the spread of COVID-19 in our region. So that's our goal. Like from a public health perspective, it's not my concern whether they're documented or not. My concern is how we can ensure that they are safe and how they're keeping our community safe. So that's a conversation I think that requires different levels of government support to bring them into some kind of a fold to ensure that their rights, their health, and their well-being is also protected. Everything else at this time is secondary. If we can find them, we need to ensure that their health and well-being needs are met.
Okay. And I promise, last one. There are some reports that we're hearing that employees could still be working at this Essex County facility under that received the order. Has this been brought to the health unit's attention?
I don't believe we've been in conversation with the facilities. I don't think that any of them who are not supposed to work, that they are working, and all those requirements are met. And we've been in consultation with them. There are a number of ministries involved, including Ministry of Labor, MAFRA, and everyone else. And it would be very unlikely for them to continue to work, and we will continue to work with all levels of government, including the farm operators, to make sure that the requirements under the Section 22 order is met.
Thank you very much.
Any questions from Blackburn?
Just to clarify, yesterday we were told that the order also included that they were not allowed to hire contract workers to fill those positions. So now you're saying that was not part of the order?
So the order specifically say that any contract workers, and just responding to the previous question as well, that the concern was about workers moving from one farm to another without having any potentially infectious and then spreading it to the other cases. So that's why the initial order specifically said that any contractors and any contractors or any new hires, they need to follow the public health recommendation and support before they can start their work. So anyone who is coming or into work, they will need to be vetted by public health to make sure that we are not bringing people who could potentially be infectious and could spread the disease. So that's why it doesn't necessarily prohibits them, but it doesn't allow them that they can just go ahead and do that on their own. It has to be a conversation and discussion with public health.
Okay, thank you.
Any questions from AMA 100?
Recommending Leamington and Kingsville reopen their small businesses. I'm just looking here at the numbers. Besides the spike from last weekend, the numbers in agri-food, the confirmed cases are fairly low the past couple of days. When you talk to the ministry this weekend and the premier, will you be recommending Kingsville and Leamington move to stage 2?
I think those conversations are ongoing, and I believe the political leadership is also involved in this discussion. We are following what the data looks like for us, and clearly trying to differentiate what the cases in the agri-farm industry versus the rest of the community looks like. So that conversation will continue to move forward, and we will provide what we can provide from our perspective.
When it comes to stage 2 in businesses in Windsor-Essex, how has the response been? Has any fines, warnings been issued to businesses? We're hearing that a business in the downtown core received a warning or a fine.
Well, our team of inspectors and the tobacco vaping and enforcement officers are out every day, and they are attending to all these calls and complaints that we are receiving from the community, and most of these are still related to education, and I would apologize. I maybe I missed the update in terms of any fines, but I'm not aware of any fines. But I'm aware that we have attended to many calls and complaints, and we are responding to that in a timely manner.
Any idea, quick ballpark? I think a couple days ago you told us it was 2 to 3. Any idea what the number stands at right now?
I will have Mike send you that information for your reference. I don't want to misquote myself, but Mike will send that information to you.
Thank you.
Any questions from Windsor?
In the slide exposure history by reported date, there were 2 recent blips of travel-related exposure, and that was the first time in quite some time. Do you have any more details on that? Were they healthcare workers from Michigan, maybe?
I believe, yes, they were healthcare workers from Michigan, but those numbers are still very low compared to what we are seeing. We know that cases in U.S. is increasing, and we're keeping a close eye with respect to what's happening in Michigan and everywhere else.
And my second question is sort of a
forward-looking question, and I guess it relates to how our health economies are connected between Canada and the States. If a successful vaccine were to be developed in the United States, and I guess this may be similar to how it works with flu shots, is it likely that we would see that vaccine distributed here quickly, or do these sorts of things usually have to be developed by Canadian vaccine companies first?
That's a good question. So typically when a vaccine is developed, it does require different levels of approval. So in Canada, we have National Advisory Committee on Immunization. They adapt that or make a recommendation, and obviously the availability, the supply chain, that's another issue, that how quickly that vaccine can be implemented, the policy can make it available for the rest of the community. And then the distribution would be another thing, that how it will quickly be distributed throughout the province, and then we have provincial governments that would help us with the enrolling of that vaccination, but eventually it will all go down to or come down to the public health at the local level for the implementation, distribution, and vaccinating all these individuals. Obviously, just like flu vaccine, as you mentioned, that there were many other players who are now doing the vaccines. So the guess is, if it's available in that quantity, it will be distributed. There may be some prioritization metrics that could be used. Just like, again, those are all the vaccination recommendation that we typically follow. High-risk groups, they get the first vaccine quickly or early than others, and then the rest of the community gets it. So it would take a little bit of time, but I think given the nature and severity of it, there's a number of conversation and planning table already working on it. And if we have a vaccine, hopefully the rest of the process will immediately follow.
Thank you.
Any questions from the Windsor Star?
Hi. So the Premier yesterday was critical of you for closing that farm down, and then the greenhouse growers had a similar statement saying it discourages cooperation and creates anxiety. So I'm just wondering if you can respond to that.
Well, I think you're misunderstanding what Premier is saying. So let's just clarify that. It was not. I didn't felt at any point that the Premier was critical of my decision. I think both Premier and myself, we were on the same page in ensuring that the safety and well-being of the workers is the topmost priority for all of us. So we are all working for the same cause, and in my order, it doesn't say that the farm is shut down. It's focused on to ensure the safety and well-being of the workers that are currently working, and also people who do not have the disease right now, how they can be protected, and if any of them develop the disease, they are not infecting other people. So that was the goal, which I think everyone agrees. There is no disagreement there. When it comes to the support of the greenhouse or farms, those conversations are happening every day, and including our team. If you're not hearing it in the media, that doesn't mean that those conversations are not happening. We are working with OGVG, and also with each individual farms as well to support them in the best possible way. They all have the same interest. They want to make sure that their workers are protected and their operation is safe. Nobody wants a full-blown outbreak in any of their farms that could jeopardize the entire operation and leading into the point where the facility needs to be shut down or all the workers need to be removed. So everyone understands that. So there is no disagreement there in terms of what is happening. We just have to make sure that the difference between an active risk or an active outbreak in a facility versus an accidental finding of asymptomatic cases or in the farm. So all those conversations need to be addressed based on the data and the evidence. And the evidence in this particular farm pointed out to the fact that there is an ongoing risk, and that risk needs to be mitigated and controlled to protect the workers that are currently positive as well as those who are currently negative but had a high risk exposure. So that action was taking place, and it may happen again if there is any risk. And I don't think that anyone would disagree if that ever happens. But right now, what I can say is we are all working together for the same cause, for the safety and the well-being of the workers that are currently working, and also safely limiting the spread of COVID-19 in that population.
Well, so the premier actually said he called him a poor gentleman trying to put these people back to work, and then you shut him down. And he did say that you think this encourages other farmers to cooperate. So you don't see that as a criticism?
No, I don't see that as a criticism, because it's just it's something that yes, everyone is trying to work for the same cause. My order never said that the farm is shut down. My order doesn't say that. So it's very clear that the order is applicable to the people who are at risk. We need to save those workers. We need to prevent the spread among that population. So the order is very clear, and I don't see that as any criticism or anything. I think we are all working for the same cause, and I've spoken to the farm owners as well as the different levels of the ministries as well, and we all agree we are all working for the same cause. It is something that we are all trying to support, protect, and the safety and well-being of the workers, as well as support the farmers and the owners in the best possible way without causing any risk to the community or to their workers.
Okay, we're going to end it there today. Thank you, everyone.